Traction is a commonly used intervention in PT practice to decompress the spine by providing a loaded or weighted stretch to either the lower back or the neck. So you can either treat the neck or the lower back. So when we treat the neck, we're using cervical traction, and when we're treating the lower back, we're using lumbar traction. So typically a patient will be coming in with what we call radicular symptoms. So those are symptoms that are traveling down the leg or down the arm, but truly originating from their spine. So for example, a patient might come in complaining of lower back pain, but is experiencing pretty significant pain in their glutes or along their thigh. So we will do an assessment of their symptoms, try to reproduce them, and see if they would be a good candidate for traction. Typically, you're looking at about 10 minutes to be on the traction device for. Depending on where your pain's coming from and what's really causing the pain, we can either set it to where it's getting you to that maximum stretch and holding there for the 10 minutes, or we can set it to where it kind of pulses, where it pulls for about a minute and then relaxes out of there for 30 seconds at a time. The traction will give that joint distraction to relieve the compression that's being placed on those nerve roots so that patients aren't experiencing that pain down the leg or the arm. If you're curious about traction, feel free to ask us any questions during your next visit or comment below.